Network service of the NTA. And just before we bring in our panel of guests, let's take a look at this background report put together by our correspondent Oyeyemi Ajayi.
Every year, on the 19th of August, the world pauses to mark World Humanitarian Day, a day to honor those who step into the middle of crisis to help others, and to stand with the millions of people whose lives hang in the balance. This date was chosen in memory of the 2003 bomb attack on the UN headquarters at the Canal Hotel in Baghdad, Iraq, which claimed the lives of 22 humanitarian workers. Since then, the day has become a call to protect the dignity, safety, and survival of people caught in the disaster, and to ensure the well-being and security of those who risk their lives to help them. This year, the theme is strengthening global solidarity and empowering local communities. A bit of a mouthful, yes, but at its core is a simple idea. When responding to humanitarian crises, the international community must not just provide aid, but also work hand in glove with local communities, treating them not as mere beneficiaries, but as active leaders shaping their own future. And the message couldn't be more urgent. The humanitarian system today is stretching to the limit, underfunded, overwhelmed, and too often under attack. And that's why putting local communities at the heart of the response has become so critical. So, what exactly does this year's theme hope to achieve? Our guests already here in the studio will be sharing their thoughts on these and much more in just a moment.
Oyeyemi Ajayi, thank you very much for the background report. And indeed, that's the question. What does World Humanitarian Day this year hope to achieve? And we have the right, of course, guests to speak to this issue. So I'll just start with the introductions. We have seated right here Dr. Yusuf Tanko Sununu, Minister of State, Humanitarian Affairs and Poverty Reduction, and also a friend of the House. Thank you very much, Honorable Minister.
Thank you very much
for joining us. Also with us is Dr. Salma Ibrahim Anas, Special Advisor to the President on Health, and it's a pleasure to have you with us, madam.
Thank you very much. All right, also joining us for the conversation is Mohammed Malik Fall, a United Nations resident and humanitarian coordinator right here in Nigeria. Many thanks for joining us, sir.
Thank you.
Yeah, you want to start? You want me to start?
I think you should pick up.
All right. Okay. Let me start with the Honourable Minister. I'm just wondering. I know you have been visiting, a lot of sites, different parts of the country, but just share with us. How do you normally feel when you visit, for instance, an ID camp or, a place where we have displaced persons or, humanitarian victims?
Well, thank you very much for having me, and thank you also for giving us this very, very important time to celebrate for the first hour of the day, World Humanitarian Day, with their stations, and also for asking us to share our experiences with the areas of conflict generally. But before I have done that, I also want to use this opportunity to condole the people and government of Kebbi State over the death of the Emir of Zuru, who to me has been one of the humanitarian champions in Nigeria through his active involvement in terms of outreaches, conflict. Zuru is one of the areas that witnessed attack by bandits, and His Royal Highness always finds himself there physically to share the experience of people. And to me, that's also not only as an indigenous of Kebbi State, but also as person, a major stakeholder in humanitarian issues. Is somebody that we need to condole people. May his soul rest in peace.
Amen.
Well, even when you ask me, I really become emotional, because you only, you can not just express it really, but there are some feelings that definitely you see at times you you ask yourself, is that really what humanity is? Somebody who is staying with his lovely people, and just for instance, about 2 days ago, I saw one video that I also cried. It's somebody in Zamfara State he made mention of the number of assets he has. Overnight, everything got burnt down. They were chased out, and he only remained with shirt, the jalabia he was putting. So you can see this such a kind of people. And a lot of people also, today we have people who cannot trace where are their relations. Some children cannot even say this is our state. I've witnessed this physically when I went to Kano State. I went to see the minors that were discharged following after being pardoned by the president. Those who are involved in the national protest that caused a lot of destruction. So when I went there, I was asked by the Kano State government through the SSG to go to Hajj camp. And I was there. What I saw really is really pathetic. These are children, about 200 of them, ranging from 5 years to 14 years old. And even those at 14 years, they can't trace where is their state, where is their this. All they knew, their house is under the bridge. And these are all people that were there because they were displaced.
So what strikes you the most in all of this? Even as, looking at yourself as take the coat of a minister off as a Nigerian, what struck you the most?
Well, what struck me most is I'm a father. I'm also a son. You understand, that enjoys a lot of privilege. Here we have a family losing that privilege as a result of human-made crisis that can easily be resolved. So it's really the feeling is that you must do much to bring relief to average Nigerian, or at least life have a human face, so that everybody can feel that really life is worth living.
Okay, let me bring the special advice, and I'll put the same question slightly different. When you look at conflict zones or disaster zones, I'm sure you also have your experiences. But what particularly keeps you awake?
So yeah, just like he said, that is the broader picture of it. It's very sad indeed, because I personally have experienced it, because I was in Borno at the peak of the crisis, posed by the insurgency, the Boko Haram. Then I was Commissioner of Health. So we were confronted with this massive displacement of people. And they don't know where to go to. Just like he said, families were disrupted abruptly. Medical care was disrupted. For instance, people that have been maybe on treatment of diabetes have just been disrupted, or HIV. And then mostly you see women and children that constitute majority of the displaced people, and also elderly people that are helpless. So you see hopelessness in the eyes of people. They don't know where to go. And what pained me the most is when I saw women having babies at the same time. And some women were aborting, having miscarriages. So it's so painful. And then you just find yourself just in it, trying to save lives of people, trying to provide relief for people. Whatever you have, whatever you can mobilize at that point. So when I remember that scene, really, it's very painful to me. And you can't sleep. It gives me sleepless night, because you just find yourself 24 hours working with them, trying to bring succor to them. No food. And then especially, I think it happened around between October to December, the first experience we had in Maiduguri. And everybody was coming into Maiduguri. And then it was the Harmattan period. The weather was so cold. So environmental factors were also there, issues of food, health. But the most painful experience that I had was seeing women. And they can only carry the number of children they can carry to run with. Because I met a woman who said she was carrying 7 kids initially, but she became helpless at one point. She ended up reaching Maiduguri with only 2 of her kids. So that was truly very painful, and that was the reality. that we saw as of that time.
All right, many thanks, Dr. Anas, for sharing that with us. I'd like to get to you, Mr. Fall. Listening to the Honourable Minister and Dr. Anas talk about your experiences, what comes to my mind is that there are efforts, even by your agency, United Nations, and then, of course, government and other well-meaning individuals in a bid to ameliorate, or if you like, reduce the suffering of many Nigerians. But yet, despite its efforts, there's, if you like, some critics would say there's minimal impact. Why is that so?
Let me first thank you for having me in your program and greet my co-panelists and say that today we are celebrating the World Humanitarian Day, and thank you for really bringing under the light the situation of the humanitarian need in Nigeria. And I was quite moved by the first panelists who spoke and who shared their life experience witnessing those things. Unfortunately, we are today in a world where I think we have never seen the kind of wealth and amount of wealth that have been amassed, but we are seeing also the most extreme suffering. And that's not only in Nigeria, it's a global situation that we see. I mean, you wake up, you see Gaza, you see Sudan, you see Ukraine, and you see protracted crisis for decades and where people are suffering. Unfortunately, it's taking place in a context where we see also a decline of funding and a decline of solidarity. And then you ask you the question that the State Minister was asking, where is humanity? Where is solidarity? Because you wonder how can one have such amount of wealth and not giving up, or state, it can be countries, it can be government, it can be individual, and not giving away for people who next to them are suffering. As we speak, for example, the humanitarian response plan we have launched for the Northeast was like 900 million. Today we are maybe less than 25% of funding. Exactly at this year, maybe we were 2-3 times higher than what we are today. We have the lean season plan, which is now only 30% funding. And we know that during the lean season, food insecurity rise, malnutrition for children, and mainly the severe and acute malnutrition for children also is on the rise. And we know that when a child is severely and acutely malnourished, the risk of dying is maybe 10 times higher than, for example, the child who is not in that situation. Where is now the solidarity? Where is humanity? And I think today's World Humanitarian Days is also a time for us to call for action. And when we say call for action, we say the international community, we say the global solidarity that should be expressed, but we say also the government, we say the private sector, the society in general. And I think some of the examples that was given by my predecessor show clearly that there is space where humanity can be found. Finishing with maybe because today also celebrate the humanitarian workers. Let's not forget that the driver of this crisis are conflict, insecurity, natural disaster, and all of these things are taking place at a time where young people, young girls, young men are taking the risk of their life every day to go and try to save life of others.
All right, let me bring this back to Nigeria. And I believe you must have also, visited some of these, areas, in need of humanitarian, aid and all that. What would you say would be the most difficult conversation that you probably have had with maybe a displaced Nigerian, a father, mother, or child?
The most difficult, because I am here as a humanitarian coordinator, yes, and in this capacity, but I served here before as a UNICEF representative, dealing with the children, mostly focusing on the Northeast, in what we call the Bay State, Borno, Yobe, Adamawa. Right. The most difficult conversation I had is when people lose their dignity, when people over-rely on aid, where they don't have hope that this life can offer them a better future. When you see them being unable to get back on their feet, because even if you put them in a camps or you relocate them, sometimes challenges related to security, access to economic opportunity become a very challenge for them to recover their dignity. And I think the most important thing for me, for a human being, is to have hope in the future, is to transmit that hope to their children, is to believe that where they live, they can find a better life and a better future there. And I think you can see it when people, years after years, are relying on humanitarian assistance, are relying on handout. They end up losing that aspect of human being which is extremely important, which is dignity.
You did say that the humanitarian crisis are worsening. I mean, it's a global issue. The worsening fund is also, declining, in the same breath. But Nigeria do receive some form of, humanitarian aid from the UN. How do you measure, impact?
What I'm saying is that as we speak, we have seen a sharp decline of funding, but the needs are not declining. The needs are even growing. That makes it much difficult to make a choice. And when you choose, usually you leave some behind or you leave some aside. And that's a morally difficult choice, because when I have 2 children, severely and acutely malnourished, if I have to choose one, the question is that maybe the other one probably will pass away. How you make those kind of choice? And when resources are declining, that's what is it. But that's why we are saying also that humanitarian assistance is something that is needed, but we need to look beyond humanitarian assistance. We need to look at also what are the structural causes of this crisis. Sometimes it's lack of preparedness to disaster. Sometimes it's lack of peace, lack of security. We need to work on those kind of prerequisites so that at least when we support people, we can support them with a vision that you need to get them back on their feet, but you need to help them also recover their dignity, access to economic opportunity, access to livelihood, get their children access to services like health, education, water and sanitation. That's how you help people to rebuild their life. And I think one of the shifts we are making also as a humanitarian and development community is that transition. And this corresponds with the vision of the government of Nigeria to help not only at federal level, at state level. I know governor like the Governor Zulum in Borno is quite strong on that one. They want the accompaniment of the international community to move toward medium and longer term development.
Before I even will come back to the minister, what I'm just asking in real terms is beyond the conceptual nature of this, aids. I'm just asking you to evaluate, the impact of UN intervention in Nigeria in the humanitarian, issue. Are we making any positive impact? Are we aligning our interventions, with needs?
Indeed, we are. We are, because as I say, for example, if you look at all sorts of aspects of people's life that are impacted by this crisis, whether it is on health, whether it is on sanitation or on education or on protection, because also you have a lot of issues related to protection, like, for example, children recruited by the armed group, children under detention, or women's victims of all sorts of violence. Those are part of also the agenda. What I can say, I can just give one example. If you take, for example, today the northeast of Nigeria, the risk of children falling into severe and acute malnutrition maybe impact around 1 million children. The international community managed to maybe move and cover up to maybe 600,000 children. But those are 600,000 children. If they were not supported by the UN-led support, probably they might not survive, because I was saying that severe and acute malnutrition can multiply by tenfold the risk of a child dying. WFP, let's say, is having a target of maybe 2 million people to be served in food. They have reached 1.3 million. Now they are at the brink of maybe getting a breakdown or a collapse of their pipeline. That's one thing. But at least those 1.3 million that were served have already been impacted. So on and so forth. There are many areas in which we have impact, but the problem is that those impacts need to be sustained. And to sustain them, you need resources. To sustain them, you need also to go beyond humanitarian assistance to move into development. To sustain them, also, you need the government, and at state and federal level, to increase its support, we need to call also the private sector.
All right, many thanks, Mr. Fall. Let's get to the Honourable Minister now. The UN says they're doing quite a lot. I would like to know what your ministry is doing. Some critics will say that the ministry is just focusing on relief and not really doing so much to lift the people out of poverty. But speak to us in real terms. What has been the impact of the intervention of the ministry?
Well, let me also join the comment of my brother. Well, as he has just mentioned earlier, is that the fact is that we are just working like putting water in a basket. So hardly you can get people, whether there is impact, people will not easily appreciate it. And that's why even the focus of government now is toward addressing the drivers of insecurity, the drivers of humanitarian crisis. And he has rightly mentioned that, and we also have to understand that addressing humanitarian crisis require holistic approach, not isolated. So if you look at the setting of the federal government of Nigeria, each and every ministry has a component that is designed to address humanitarian crisis because it's aimed at improving prosperity of average Nigerian. If you look at education, you cannot address humanitarian crisis without education. If you look at health, if you look at Ministry of Labor and Employment, if you look at Ministry of Works, because even access to where there is conflict is part of humanitarian resistance, because if you cannot access it, the damage that will have been reduced within the shortest possible time will have exploded and caused much damage. So as a ministry, ours, part of it is coordinating humanitarian responses, and that's why we have stakeholders engagement virtually at every level to see how we can get ourselves coordinated. And I must thank the United Nations through my brother for their support to the ministry. We had a first engagement and very soon stakeholders engagement. Very soon we'll also have a summit before we move to National Council of Humanitarian Affairs so that we can get a better coordination. And then also we have to mitigate the issue of poverty and also address the concern of those people of special needs. And this we have different pattern of approach. We have the rapid response, and then we have durable solutions. Now, in this rapid response, we all know that Nigeria has a national social register that is very, very robust, containing almost 18.9 million Nigerians who are vulnerable groups that need to be assisted. And Mr. President has granted that permission for them to be assisted through the rapid conditional cash transfer that has been also continuously going. And as of today, I want to say that we have reached over nearly 6 million Nigerians. And the total disbursement to those Nigerians, that in terms of household, we have disbursed almost 419 billion naira. And before the end of this August, in the next few days to come, we're also reaching another 2,199,000 Nigerians with a total sum of 54 billion. I think it's 850,000 naira as a rapid conditional cash transfer. This is just to mitigate their effect. And also we are using our national social register to develop an anticipatory response, most especially in areas that we think there may be conflict or there is going to be a flood as been predicted by NIMED. And then not only that also, I mentioned that we are planning for sustainable and durable solution. All we have seen now in the last 72 hours, we have been closely monitoring social media. It's really alarming and shocking because the kind of flood we had, the road collapsed. A lot of road connecting cities have collapsed. This is also another humanitarian crisis that we have. And definitely that is also affecting our food security. And then as a ministry, we are planning to see how we can empower Nigerians, most especially smallholder farmer, with a stipend that will allow them to go back to their home. So we are reaching in the next 1 or 2 months to come, while we are preparing dry season farming, 21,000 Nigerians with a interest-free, collateral-free loan of 300,000, which people may think is not something, but a farmer who is into vegetable farming, if you can grant him a loan of 300,000, that will really impact positively on his productivity. Right. Even as a big farmer, it will address his issue in terms of energy need to power his generator or even to get some certain fertilizer and that can all be targeted to improve his productivity.
The initiative for farmers is a great one. But speaking about what you said earlier, you talked about the conditional cash transfer. Yeah. And like you mentioned, of course, it's in the papers this morning, 2.2 million households will also get some amount of money. But you just said earlier, and Fall also said that the impact seems not to be visible. So why is the federal government not looking at another way of reaching people who are vulnerable instead of cash transfers? Because cash transfers, we know, and of course in the news, transparency issues and all of that, and then the people who actually get these transfers, according to some reports, are not actually those in need. So why is the federal government not looking at other ways of dealing with this issue?
Let's understand the kind of intervention we have in Nigeria. People keep on saying politicians are hijacking this. There are two different interventions. The national conditional cash transfer is not based on political party, it's not based on ethnicity, it's not based on this thing. This is based on people who are already in our national social register. That in that register, I bet you there's no political party, whether AD, ACN, PDP, APC. You understand? And this register is constituted through joint collaboration with international community, including World Bank. So even if we harvest out of 18 million, if it's harvested
when
by
was that register updated?
The update is ongoing. You understand? The ongoing, what is there, when the register was first formed, there are some key issues that we raise concern on, the country raised concern in, including the international community. That is the digital identity, to facilitate tracking and accountability. So some have their NIN, BBN account number and even telephone numbers, but others don't have. So we are now extracting from that and validating to go back to the grassroots and get those items. And in fact, we are not happy with the rate at which NIMSI was going. So just Friday last week, we have to employ more private institutions who are now going to be given the contract to validate. So as assist NIMSI, and then they will be paid directly by NIMSI. You understand? And that's about 50 of them. And I think by this week, either Wednesday or Thursday, they will be moving out so that more Nigerians can be reached out. You see, the whole issue is about when you say transparency, people have this. Let me tell you one thing, and it do happen in a family. Husband and wife, if the husband receives conditional cash transfer through his phone and he got his alert, he may not even want the wife to know, talk less of other people. Now, if we say we are going to pay them massively, we have also that possibility is that you have paid only 50,000 and you are claiming you have paid 500,000. So what we have agreed now is to make it more transparent and accountable. Anytime we are going to dispose funds, we will address the press, we will give the figure, and we give each state, we will tell them the beneficiaries. And it is also ready, we will be ready to have a dashboard that can confirm what we have done so as to improve the transparency. This is very, very vital.
Yes.
The international community, from what they read previously, develop suspicion about the ministry in terms of transparency and accountability. And it's also affecting the support we are getting from the international community. Mm-hmm. And he said when we came, we have to sit down with them to agree to say, okay, for us, we have two issues now. Improve on your transparency, improve your local investment to support people, and then we guide you how we'll do it. Time is gone. That I can recall, Mr. Paul says, we cannot give you fish now, but we'll teach you. Remember that your statement? How to fish. And that's what we are doing now.
That's fantastic.
Yes.
I'd like to, because you brought in these, cash transfers. And I recall that the cash transfers actually started from the period of the MDGs. And it was really not targeted at those we call humanitarian victims. It was targeted at, the poorest of the poor, the extreme poor households.
Yes.
So, and that's prompting my question to you. In real terms, really, when we say humanitarian victims, who are those? Who are we talking about?
You see,
because we seem
the National Social Register, you see, humanitarian victims are people who are trapped in crisis, conflicts, or even disaster that have an immediate special need that will be treated as an emergency.
Beautiful.
You see, you can't be a multi-billionaire today. In the next 1 hour, you can be a humanitarian victim that requires the most urgent help. It's just like definition of health. Health is not an absolute state. Mm-hmm. It's a relative. Today, now I can be healthy. In the next 30 minutes or 10 hours, you see? So that is also what it means by, and I mentioned earlier in my statement, that somebody came in Sokoto. He said he has all this. In Zafara, he was crying. He's an imam, I think. The video circulated. But he said within 1 hour today, he can only own the clothes he slept with. So you understand? So it's there, you can be, and then a national social register is not meant to be a permanent destination. It's meant to be a record of people who are vulnerable, need assistance to avoid them going into shock, and need preparation to a durable solution to allow them exit that register so that they can be self-sustaining. Mm-hmm. And I think that is the concept.
Let me
so,
yes.
And what we are now saying is that National Social Register, we can also utilize it in anticipatory response or in response to emergency, because already we had the list of those who are vulnerable groups, and even if they are shocked, they are the most severely affected. Let me tell you, it's just like sometimes I used to bring medical this in. It's all called medical triage. If you have 30 patients, you understand, the rule is that don't accept them as just patients. Triage them to find who need urgent response, that's a life-threatening condition.
Let me talk about coordination.
Yes.
Because you talked about coordination, and I know your ministry is the coordinating ministry, but you also have, departments in other ministries also doing the same thing, thereby fragmenting, our resources and all that. I mean, don't you think this fragmented, measures are also impeding on the success of your interventions?
No, I don't think so if there's a proper coordination. You understand? As I told you, humanitarian response is a holistic approach. Now, if we take it's the sole right of Ministry of Humanitarian Affairs to do everything, that may not work. For instance, I will cite a certain example. If we say we are not going to coordinate with Ministry of Health, in humanitarian crisis, what are the needs? First, you have to save life, you have to provide food, you have to provide water, and then you have to also provide us shelter.
But you could also have a unit, under your ministry. So you
see, those units can only work together with international community and other partners to coordinate that. Because, for instance, now, if there is this, should we say all the ambulance of the Federal Ministry of Health will be under our custody? No. But it should let the Ministry of Health know that, look, we have an emergency. We need so number of ambulance. And this ambulance, this is where they should go. And our team are there on ground to assist in coordinating their responses. You understand? So no ministry can go in isolation. Okay, if we say we are not going to work with finance, ministry emergency need require emergency procurement. And it means we must work closely with finance and even the Office of Bureau of Public Procurement, so that they can now do an emergency procurement, this thing that will not delay the procurement of items that are needed. You understand? So ours is to coordinate, and that's why even now we realize that there is even at national level, there is no coordination, because we don't have Council of Humanitarian Affairs and Poverty Reduction that will now coordinate all the national develop policy that is owned by Nigerians. And it is that reason that made us to make a presentation to Federal Executive Council. And I'm glad to say that the Federal Executive Council has approved the inauguration of the Council of Humanitarian Affairs and Poverty Reduction, which even the United Nations has been fighting, pushing Nigeria to please get a council that will coordinate our activities.
All right, many thanks, Honorable Minister. Let's get to Dr. Anas now. I mean, when you want to deal with humanitarian crisis, health is critical, in fact, the most important. I mean, before you talk about any other thing, getting to people, you want to ensure that they're healthy. But for those not even in crisis, those who are not in any humanitarian issues or whatever, seem to be having a difficulty assessing adequate health care, or if you like, optimal health care. Some say that the health system in Nigeria is critically ill. So I'm thinking, because I mean, you're special advisor to the President on health. What initiatives are in place? I mean, to deal with some of the issues. I mean, you go to IDP camps, you go to places, shelter for people who have been thrown away by flood and all of that. There is a critical health challenge. There's no medical personnel. There's nothing really available on ground. Speak to us what the government is doing in that regard.
So let me start by saying that, just like you said, and the Honorable Minister also reiterated that health is a critical component. The first impact that is most felt is on health when there's crisis, when there's displacement of people, when there's any form of crisis. The first is health. From the time that you are displaced from your home, there are psychological trauma immediately. And then food is another issue, which is directly related to health. The environmental exposure is another aspect of it. The disruption of healthcare services, and then education of children. So health is most felt, is the most one, and it's very critical that immediately we have to establish health. And if you recall, in my last discussion, I said that President Bola Ahmed Tinubu, the Renewed Hope Health Agenda, is committed to ensure that all Nigerians have access to quality healthcare services wherever they are, irrespective of your gender, irrespective of your socioeconomic status. So the whole aim is to attain universal healthcare coverage. So that does not exclude people, vulnerable people, or victims, as the Honorable Minister has said, victims of humanitarian crisis. They are all included within this. So what we are doing is to ensure that we bring healthcare close to where people are. So even if you go to our IDP camp, and I have this experience myself when we had that crisis, at the peak of the crisis, the first thing we did was to bring healthcare close to the people. And we established healthcare, integrated healthcare services within the IDP camps. In fact, it's so interesting as of that time to note that some of the IDPs that came from communities, for the first time they were having access to services, which they never had before. Children were screened, everybody was screened in the camp. Children were immunized. And then, of course, then we started identifying the massive malnutrition, which was discussed. And then women were also having access to family planning and sexual and reproductive health services within the camp. So this is to show that no one is left behind, including people that are displaced within facilities. So this is part of the efforts of this administration, which has also continued till today. It is prioritized that no one will be left behind, including people within the IDP camps. So some of these new initiatives that I can see that came under the President Bola Ahmed Tinubu's Renewed Hope Agenda is also expansion of the scope of work of the Federal Ministry of Health. It used to be Federal Ministry of Health in the past. So President expanded the scope and mandate of Ministry of Health to include social welfare. So today we have what we call Federal Ministry of Health and Social Welfare and a coordinating minister. So just like Honorable Minister Sununu mentioned, health does not stand alone as an entity. It's all encompassing, and we work together with all other sectors of development. So we are also a critical stakeholder working with the Ministry of Humanitarian Crisis. When you talk about humanitarian crisis, we also work with them as a component to deliver quality healthcare services. And this is also the same with all other sectors like water resources, agri to deal with issues of malnutrition, and even the military. We work together with them to ensure safe spaces and security. Because one major issue that also came out that we experienced from impact of humanitarian crisis on health is the sexual and gender-based violence. And this has been happening silently because of cultural norms. Women are not comfortable speaking out, and families are also not comfortable saying it because it's a kind of derogatory and also discriminatory. But through working, in partnership with several partners, we're able to identify and make women to open up and started creating safe spaces for women. And girls especially, girls have been severely affected by abusers within the camp as a result of all the displacement that has happened. So what am I saying here? I'm saying is that, just like he said, using his word, his holistic approach, it requires more harmonization, working together, and then effective coordination, very important, not only at the federal level, but up to the lowest level of the camp where services are being delivered. There is need for strong coordination. I'm not saying we are perfect in that. It's still work in progress. We are still struggling. It's one of the major challenges of experience of work that I have experienced is to say one of the major challenges is getting different players of Nigerians to work together in different sectors. And this is still a struggle. Even within the camp, it's still a struggle to put all the pieces together to work together. But I can comfortably say that we are on track. We are making some progress in that direction. But of course, there is much more to be done.
We're talking about struggles.
We can maximize effect of the limited resources that we have.
All right.
To have a maximum impact.
Talking about struggles, Madam, those who struggle the most in this kind of crisis are children. Has that been a deliberate effort, to look at, ensuring that the children in these situations, are as healthy as possible?
Yes, thank you so much. There's a deliberate effort, and this is part of the most recent discussions we are having together with the Honorable Minister of Humanitarian Crisis. Children are most affected, as I said, in addition to women, and children are most affected. So as soon as they come to the camp, the healthcare services we target is across the spectrum of health promotion, protection, prevention of diseases, then treatment of children. So immunization is a critical component of it. Educating the families also about hygiene is very important. Water and sanitation is an integral part of it, which we are working together with the other ministries and relevant partners. But the most recent one we just realized also was about the psychosocial impact on health, on children. Because these are children that have seen nothing but war, terrorism, or hardships, within their environment. So it definitely have an impact. And we are working also with the Ministry of Humanitarian Crisis in collaboration with academics that have done also some studies to see what are the Office of NSA. And the Office of NSA, exactly, to study what are the impacts on these children, because they are the future generation. They are at the foundational age. So how is it going to impact on them and also the future of Nigeria? So these are areas we just started working with, led by the Honorable Minister Sununu, to see the impact, and we are trying to have a dialogue to bring all the relevant people to discuss how do we ensure that we recognize this, and also it will have a very huge impact on the future of Nigeria. And how do we address those issues? So these are discussions that are currently ongoing to address those issues of impact. And then I have also have an experience. I was opportune to work with FHI 360 as a country director. He talked about the dwindling resources, which was heavily funded that time by USAID. And it's one of the largest projects in the northeastern part of Nigeria. And part of what we do there, apart from health, was targeting education. So some of the kids have been in school, some have never had contact with education. So it's to see that how do we ensure they continue with their education within camps. So our classes were set up within camp and they were having access to education. And even those that have never had access, they were also for the first time exposed to education as an opportunity for them. And I'm glad to mention that one of the best practices we saw was in Borno State, where the governor, Governor Zulum himself, was able to transition those children, and young people to a formal education. And we saw them moving forward in terms of guaranteeing and securing their future education.
All right, thank you, ma'am. Let's bring in Mr. Fall now. And I'd like you to speak to how we can ensure efficiency, or if you may improve efficiency. I'm wondering what you think about coordination between UN agencies and the various institutions in Nigeria that handle humanitarian issues.
You're absolutely right. Coordination is a sector where we can gain efficiency. And coming back to the health, I feel that we need to do more justice to the Minister Pate and to the Minister of Health, because he has launched what we call sector-wide approach, which is bringing together all the partners with the aim of avoiding fragmentation, overlap, and duplication. I think the State Minister, my brother Yusuf, have mentioned also the effort we are doing in the humanitarian front. We had already last March a round table, which is supposed to culminate in a kind of forum that will help to establish a national council. I think coordination, avoiding duplication, avoiding overlap, avoiding fragmentation is an area where we can have a huge gain of efficiency. The second area of efficiency we are looking at too is to use local organization through what we call localization. By localization, we mean actors that are on the grassroots level are used instead of international organization or international NGO. Like in Nigeria, we have what we call the Nigeria Humanitarian Fund, where we raise money to support, for example, the operation in the Northeast, mostly in Borno, Yobe, and Adamawa. Last year, we have used 60% of the allocation to local organizations. They were the most eligible. Then we did a kind of study to see how much efficiency gain we have. We found that between 20 and 25% efficiency gain was there, because salary are lower, they know the ground, they can navigate some of the complexity in much better way. The second area of, the other area of efficiency is also the use of new technology. Like, for example, now WFP is not doing anymore almost in-kind donation, bringing back bag of rice. They give, for example, to beneficiaries what we call electronic wallet, where they can get, for example, money transferred to that electronic wallet, and they can go to any shop that is accredited by WFP and get access to what they want. Not only it increases the efficiency, but at the same time also you give people dignity, you give to people rice and oil, probably they have some more need than that. And then these are the kind of operations that we see are making truly a kind of huge saving in the operation. And moving forward, and with the scarce resources that we are having, localization, increase efficiency, avoid fragmentation, those are the areas in which we will double down moving from now onward.
All right, Mr. Fall.
Sorry, most Nigerians see humanitarian, programs as handouts. I mean, every now and then you see, reactionary measures. People, are given rice, are given food items, and all that. But can you speak to us about, in practice, what should be the scope and content of humanitarian aid?
Let's just say that when you have a humanitarian shock, as it was mentioned earlier, you have to race against the clock to save life. When people are victim of an attack, when people are victim of a flood, or are victim of a natural disaster shock, yes, of course, you have to prioritize what saving life is. And saving life, most of the time, it's respond to possibility of disease outbreak. you do immunization, you do sanitation to avoid explosion of waterborne diseases, or you give people food because they need to eat to be alive, and then you focus on shelter. What is now needed is that how you help those people to transit from that immediate need of life-saving to something that helps them to come into the path of recovery. And in the recovery process, how they can get back to maybe having livelihood, accessing economic opportunity, revitalizing the services like education or health. And that's why we launched in the Northeast and in Benue State what we call durable solution. A durable solution is just not to maintain the IDP in a camp, but it is also to maintain, to give to IDP opportunity to get back on their feet through livelihood, through access to economic opportunity, through providing service to their children, but through also bringing back social cohesion, social mediation, reconciliation between communities, and also providing what my sister was mentioning, which is mental health. Because
to what extent is what we are doing aligning with this?
It is. For example, now as I speak, Borno, Yobe, Adamawa, Benue have what they call their own state plan for the reintegration, for durable solution for IDPs, which mean IDP are not anymore maintained in camps. And those durable solution plan have several components. One is bringing back peace and social cohesion. The other one is helping to get opportunity and livelihood. I was with the Minister of Humanitarian Affairs in February in Benue. The governor have given big plot of land to all the IDPs so that they could get back to farming. And housing is also another component, and providing basic services. And all those state plans are costed, are budgeted, and we had also commitment, like state like Borno, the governor has accepted for the 3 coming year to allocate 15% of its budget to the state plan for durable solution. In state like Yobe, it's 14%. Any of those things shows clearly financial commitment, because if you don't have also financial commitment from the government, the international community alone cannot also bring all the resources.
All right. Talking about the international community now, I want you to speak about the United Nations specifically. How much is spent, annually in dealing with humanitarian crisis in Nigeria? If you cannot give us for a long period, tell us about last year, 2024, how much was spent. And then speak to us about a particular initiative of the United Nations that is linking humanitarian aid to long-term economic empowerment.
Last year, I think we were like $580 million US that was spent in the humanitarian response in the Northeast.
Northeast alone?
Northeast alone, because that's where we have the humanitarian response plan. We do intervene in the Northwest and other part of the country, but this is part of the broader engagement of development. But that was like that amount. But let me remind that out of this, maybe 50 to 6% was coming from US. My sister mentioned FHI 360, USAID. We all know the kind of situation we are in, and that's why earlier in this conversation I was alerting that we have the decline funding that we are facing. Now, what we have done, as I say, part of it was for saving life, because you have all these children whose life is at stake. You have all these pregnant or lactating women whose life are at stake. You need to
away from all of that, what initiative on ground that has led to empowerment of Nigerians?
That's what I was coming to, and I think I touched upon it. It's the launch of the State Plan for Durable Solution for IDPs. Out of the initiative of the UN Secretary General to support displacement in like 15 countries in the world, Nigeria was the first one in 2024 to launch its state plan. We start the state plan in Borno, Yobe, Adamawa. We start costing it, and as I say, those plans have different components that are durable. One is housing. The other one is access to life.
How does that work? Do you support the government, or you're doing it on your own?
No, we support the government. As I say.
So what's the percentage?
The government, for example, in the context of Borno, they were putting 15% of their state budget into it. The World Bank was coming with a program called SOLID, to which they will support. UN was repurposing money from education, UNICEF, UNESCO, Health, WHO, UNFPA, and those money that was repurposed was invested into the service that was helping children in relocated or in durable solution site to access to education.
All
and
right,
I think
Mr.
those
Fall.
were way of maybe moving from immediate humanitarian assistance to
long-term
medium and longer term
development.
development.
Mr. Farr, thank you. Thank you very much. We've got some comments coming in, and I don't know if we can take it before we go for a break, a short break. Akeju Olagbajo says social register is not targeted to cover humanitarian victims. It's important we have a separate register to be more precisely, otherwise humanitarian benefits will be poorly administered. Austin Amoka from Bauchi, aside from giving rice and vegetable oil, displaced populations face protection risks, especially in Kebbi State. Gender-based violence, I think Ajay, you talked about it, abduction and other forms of underage sexual exploitation. Has the Department of Humanitarian done anything really to curb these? I also have another one, Asiya Ibrahim Asaga, a humanitarian enthusiast. He said, let's aggressively sustain the grassroots community's enlightenment through inclusive stakeholders' participation. They are humanitarian enthusiasts who are doing much in this regard, and foreign aid shouldn't be limited to state, national government, but cascaded directly downwards to the people in need. I don't know, Yere, you have some?
Yeah, quite a number. This one says, yesterday may be special, but every day is Humanity Day to reflect on the plight of displaced victims. A visit to a stadium and Bakassi camps in Borno State revealed that we need to do more. The benefit should go beyond safety net or palliative to provide them with livelihood. UN needs to do more in this area by collaborating with all tiers of government. Another one says, hello, good morning. I am Mohammed Nasser from Kaduna. I have a question. When is the Humanitarian Ministry going to pay us our 2023 NPower stipends? Another one says, World Humanitarian Day, empowering local communities. Kudos to NTA with this enlightenment platform. Humanitarian crisis, whether man-made or natural disaster, has enormous impact on communities and requires inclusivity in its resolution. Most times we focus on foreign, if you like, global aid, forgetting community and local inputs, and which the latter is fundamental for the effectiveness of the former. Now that's coming from Asa Abraham at Saga, humanitarian enthusiast. Another one says, good morning, Ma and sir. I've been following NTA this morning on this. Those of us in Kogi State are left behind. How can we be part of these empowerments? Omaiza Salihu from Kogi State. Another one says the concerns about transparency in the empowerment programs of the Ministry of Humanitarian Affairs and Poverty Alleviation are valid, especially considering the allegations of corruption and mismanagement of funds. To address these concerns, publishing the list of beneficiaries in national dailies could indeed help confirm the genuineness of the program, because I have not seen a beneficiary in my state. Instead, those are those of the ruling party. Abdulkadri Adebayo Ozijomo Okene from Kogi State Center.
All right. Thank you all for your comments. Please do keep them coming. The number is right there on the screen or will be displayed in a short while. And, of course, our guests will take some of the questions when we come back from this break. Welcome back to the program. You're watching Good Morning Nigeria, and it's World Humanitarian Day. And we're looking at, of course, the processes and how we can improve efficiency. And Inyere, you have some questions? Oh,
just the ones we've read.
Yes. Can you repeat so that the guests can?
Okay, well, basically, I'd like the Honourable Minister to respond to the one that came all the way from Benue and from Kogi, talking about being left behind and not feeling the impact of some of these initiatives. Just quickly summarize, Kogi State, yes. I'll quickly summarize. Another one is talking about the transparency issue. Another one says, a visit to stadium and Bakassi camps in Borno State revealed that there is need to do more, and it's also saying that the UN needs to do more in terms of reaching people in need in the country. These are just about...
So let's start with the
summary.
Minister.
Well, thank you very much. I think the Kogi is left out. That cannot be correct. In fact, I can, if I permit it, I can go to my phone now and I'll tell you
please.
the number of people from Kogi State who have benefited from the rapid conditional cash transfer of the federal government. Kogi, we have 213,891 recipients.
From Kogi State?
From Kogi State. So you understand, it's what I mentioned earlier. You see, a couple can decide not to tell each other what happens. You understand? You receive an alert in your phone, you are at liberty to either tell somebody you have done that or this. And that's why we said, as at today, the rules is that whenever we are going to disburse, 48 hours to disbursement, we will address press.
What about publishing the list? You know, there's a question that came in here talking about publishing the names of those who benefit, just so that they can be sure that these are real people. Because one says, I've never seen anyone.
No, you see, let's understand one thing. You just mentioned about dignity. You understand? Mm-hmm. And there's also confidentiality in terms of data. But if you follow legal rules to find out who and who are beneficiaries within the confine of the law, that will be done. Mm. There are some families, once you mention them, that they are in National Social Register, it creates a lot of, what do you say, biases, stigmatization, and we have to reduce that. So we have to protect their dignity.
Okay, so
it's just like putting them in line, pushing them, flogging them to collect food. So that's all what is mentioned about dignity.
This other question, is it feasible to have a separate register for those in need, humanitarian needs?
We will have registered of those who are in emergency response need. You understand? But you see, that is also a temporary one. For instance, you cannot remain there. But National Social Register, you can have vulnerable people who are in that National Social Register. And I mentioned that they are the most people who need urgent need. So you can reach them through your National Social Register. But you must also take an audit. And I mentioned, for instance, a billionaire can be the person that is in the most special need at that moment, when he has nothing, and somebody who has been comfortable before now, anything, either road accident or these are issues. So you understand? So what is most important is you have vulnerable groups in their register, and you have a strong and effective emergency response preparedness.
Okay.
So that those who are not in the register, when it happens, you can easily trace them, you can reach out to them, you can listen. And that's why, for me, as personal, on my own personal capacity, I always want a NIMC to have a situation whereby we have a single data pool that can address everybody. For instance, when I was appointed as a minister, immediately I came, I went to DSS, I gave my data. I went to screening with the police. I gave my data.
Because
I went to National Assembly. No, I'm coming. I gave my data.
Man, so you need to do that.
What I'm trying to say is, why can't we use our national identity number that we have?
Absolutely. Centralized space.
Everything about us, so that if I'm coming to your office for documentation, I don't need you to give me forms. You have spent that money. That money can be used for humanitarian services. That papers that you are going to give me, that would cost government almost 20,000. It's enough to provide meal for 3 days for someone. So let me just give you my INN. You either scrolling for me to go through, or is there anything you want to edit? Is there anything you want to add? You understand? It's safe course.
I'm sure coming from the Honourable Minister, I'm sure that it has some power.
I'm just saying that
this is what every Nigerian,
that we need to get ourselves coordinated.
Yes.
So that you don't need to duplicate this.
Yes,
if you go now for your driver's license, you give them this. If you go for your passport, you give them this.
Just last question before we go to Aja. This is from Donald Tor from Benue. Honourable Minister, what's your ministry doing to reconsider N-Power?
Yes. Even yesterday, they have their national chairman. We had a meeting with him in our office, and I told him that ministry is working hard. We have gotten their addition. Once the fund is released, they will get their pay immediately. That's one. And two, we also have, it's not that it's this thing, because of what happened in the ministry, there was a suspension, not this thing. N-Power is an act of National Assembly. and we have made provision for it in the 2025 budget. And as soon as the money is released to MDS, we will open our portal and get people registered so that we continue. But the only thing, we are going to make it a little bit more different to connect it to labor market. Not just you come and serve 1 year, 2 years after you don't have any skill to add value for that period, and you cannot make yourself marketable. So we'll make it a bit better and robust so that it can have it on its own a durable solution added to it.
Yes. Honorable Minister, you already made mention about why you don't want to publish, but this is a question here. I want you to listen to this. It says, there are some people whose names are in the social or humanitarian register, but they do not know. Can't the register or list be published state by state and local government by local government so that people can access it easily? Some had some corrections made on their own data in the register, but have not received any payment since. Probably the corrections were not properly made. So please, publish the list state by state and local government by local government so that people can check for their names easily. It's coming from Umenfuru Hyacinth in Abakaliki.
The validation, as mentioned, initially was done exclusively.
Is it possible for somebody's name to be on that register without knowing?
It's not just possible because you must have been interviewed to provide the data. Yeah. You provide the data yourself.
Okay, there are no ghosts.
How can they be ghosts?
Okay.
You see, that's why to avoid being ghosts or not ghosts. And that's why the concept of digital identity is borrowed. You know, there's no way a ministry can go and open up. I've just mentioned a huge figure now of 2 million and something that we are going to disburse in August.
But so what could
how can the ministry open up this in account of them? But it's easy for me to come and bring 200 people and multiply it by 10. They said I've given to 2 million. 200,000 is a huge crowd. And I said I've given to 2 million people.
So these payments are made
But now these are account numbers. Okay. They are bank. They are individuals. They are live. You understand? That you can go and verify. And I said henceforth, just like the federal, what do you call it, this disbursement of the federation account, is telling that in Kebbi State we have given it, in this way, we also said in Kogi State we have given so people, and then this is the total amount.
Rather than publishing names and all that.
Yes.
Madam, there's a question for you. Underage sexual exploitation in IDP camps. What's the Department of Health doing to cut this?
So let me just give a brief background about sexual exploitation. You know, that came as a result of humanitarian crisis. You know, it's at 3 levels. At the point of the threat, there's sexual exploitation. You know, you are also aware of the abduction of the girls. Before the abduction of over 220-something, 56 Chibok girls, there have been abduction of girls within communities, especially around northern Borno area. And then it has always associated with sexual abuse, sexual exploitation. And in fact, there were instances where we have an exchange of material needs with girls at that time. So that happens at that level. And then when they come to the community, of course, host communities plays a very important role in hosting internally displaced persons. Because before they go to the camp, a lot of families absorb, and friends and relatives within their homes. But also within the host communities, also there are exploitation and sexual abuse. And then within the camp, at that level also. Even the security agents also that are expected to protect them also exploit them. And in some few instances, also we've had instances of even health providers and humanitarian workers also exploited.
So what's
exploitation happens all around that. Of course, there are measures put in place, and we take that very seriously. It is zero tolerance to exploitation of sexual exploitation. So once it is detected and reported, it is punishable. So there are measures that have been put in place, and also encouraging, promoting women and girls to speak up if they experience such exploitation, to report it. So there are lines of reporting, and action will be taken, disciplinary action will be taken immediately.
For those in IDP camps, who can they report to?
Humanitarian aid workers have been trained also. There are trained humanitarian health workers that provide information and counseling. So they can report to any one of the health workers, and this can be escalated.
All right.
Because it's totally zero tolerance. It's not acceptable for that to happen within the camp.
Let me also ask, because I know there's a campaign, it's been on, about providing free sanitary, towels for young girls. Is this also being considered for young girls in the IDP?
Sure, it is. It is by the government and also the UN. A lot of agencies support provision of sanitary pads and encouraging them. You know, it's all part of the WASH program as well. So they have access to sanitary pads and all, and also education, informing them about a lot of things about their sexuality and how they can take care of themselves, and access to family planning within the camp also.
All right, many thanks,
All those
Dr.
measures
Anas.
are there.
Mohammed Fall, while Dr. Anas was speaking, you talked about humanitarian aid workers, some being trained, some found doing the wrong things. Speak to us about what the UN is doing. I mean, on the side of government, we've seen government trying to stop corruption and block leakages, and of course deal with, you know, staff of the ministry who do the wrong thing. But in terms of humanitarian aid workers in your organization, how do you ensure that they do the right thing?
I think, as Dr. Mariam was saying, in the UN, I think now it has been more than 10 years that sexual exploitation is under a zero tolerance policy. It's not just a statement, it's just also some state of compliance that is required for everyone working for UN. In my office, I have a special advisor on sexual exploitation and abuse who guide and remind the principal. We have an action plan to monitor, to report, and to respond to the need of the victim of social exploitation. Like I talk about the Nigerian Humanitarian Fund, there is a principle that everyone who access to that fund commit to refrain from sexual exploitation, not as an organization, but as every individual working for that organization. They have to sign that agreement. They have to commit that they will train all their staff in the kind of risk and the different form of sexual exploitation. And they know that any organization that have staff caught in action, if you don't take the measure to address it, it will lead to the suspension of your funding.
Sorry, Mr. Fall, I have to stop you. We have just 2 minutes, and we need to share the 2 minutes. Let me ask Dr. Anas here. I mean, if you had the opportunity of deploying intervention for a priority humanitarian issue, where would you deploy it?
I will deploy it anywhere where we have internally displaced persons as an emergency to reduce their sufferings, to save lives, and make them comfortable, and also deploy humanitarian workers. But remember, we are celebrating humanitarian workers. I want to encourage them. I want to encourage them despite all the challenges that they face within and outside. They should keep doing the right thing, and we should also aim to try to be humanitarian in nature.
All right,
Minister?
Honorable Minister, as we round off your final words, and then what would you like to say to Nigerians who feel abandoned in all of this?
For the Nigerians, generally, let me say that I'm bringing the goodwill and wishes of Mr. President, who honored today those who sacrificed their life while giving humanitarian assistance, and those who are also struggling at all times to give humanitarian services to citizens of Nigeria who are in need. And to say, Mr. President, stand with them, and will also continue to empower local community. And for those, nobody is abandoned. But the other thing is that while we are working hard to ensure that we reach everybody, the government is doing its own best to address the drivers. If you didn't address the drivers, you continue to have victims.
All right, Mr. Fall, maybe in 30 seconds, speak to the humanitarian aid workers today.
Maybe before that, I will say malnutrition and food insecurity are priority, mainly during this lane season. You have over 3 million children who can fall into severe and acute malnutrition. You have millions of people who face food insecurity. I will call for government, for the international partner, for the private sector to address this. Now I will continue my encouragement to all the humanitarian, men and women, who every single day take the risk of their life, work out of their way to save people's life.
Thank you very much, Mohammed Malik Fall, United Nations resident and humanitarian coordinator in Nigeria. It was a pleasure to have you. Thank you so much. And we hope that you keep up the work that you're doing. Dr. Salma Ibrahim Anas, Special Advisor to the President in Health. Thank you so much, ma'am. It's a pleasure to have you. You were with us last week and again with us today, so maybe we should add that you are one of our regulars now. Thank you so much. And of course, the Honorable Minister of State, Humanitarian Affairs and Poverty Reduction, Dr. Yusuf Tanko Sununu. Thank you so much for your insights.
And I think I'm qualified to be giving consultancy appointment. Since I have a permanent chair.
All right. Yeah, you need to sign off.
All right, so that's Good Morning Nigeria today. Thank you so much for watching. I'm Ian Ray John. Join us again tomorrow.
And we thank all those who are working for humanitarian needs. We thank the United Nations and all their agencies. I'm Claire Adelabu Abdulrazak. Bye-bye.